Amy Abels from Pure Aesthetics and Wellness is our guest. Good morning and welcome.
Good morning.
It's good to see you. What's aesthetics? Like, what does the word aesthetics? What does that mean?
For us, medical aesthetics is beautifying and redefining your look and basically preventing aging, which none of us are a big fan of.
Yeah,
Using medical things, I guess you would say.
sure. And the wellness part is pretty self-explanatory, but you've got sort of a wide approach to beauty and wellness and many tools that you use to incorporate. Now, Amy, I've known you for a long time, and I know there's APRN at the end of your name, but then there's a bunch of other initials at the end of your name, or a bunch of other letters, MSN, FNPC. What do all those mean?
Right. So I have a master's degree in nursing. I specialize in family nurse practitioner, and I'm board certified. So.
And when you decided to bring a facility like Pure Aesthetics and Wellness to Litchfield, I guess you looked around and saw that services not really available locally, or at least readily available. What was your goal in bringing Pure to Litchfield?
Correct. So when I was living in Denver, Colorado, it was easily and readily available right down the street. And so I feel like people here growing up in this area, one, you don't really know a lot about that kind of market, I feel like. And if you do, you have to go to Louisville, Nashville, Owensboro, Bowling Green. So those services are not really something that are readily available or close. So
I would also imagine that when you're talking about Louisville, Nashville, and more populous areas, real estate's more expensive, leases are more expensive, cost of living is more expensive. I would presume you have the ability to be maybe more competitive than if you had to leave town?
we definitely are. Yes.
Yeah. The other thing I think that is interesting is you didn't just one day sit and decide, you know what I think I'm going to do? I'm going to bring an aesthetics and wellness clinic to Litchfield. You actually went about a long journey of doing this and becoming qualified. I guess it's my way of saying you do know what you're doing.
Correct. Yeah. So I was hired by a corporate healthcare company during COVID and traveled and got into the med spa space. We got trained in Beverly Hills by a plastic surgeon, and then done some cadaver labs for safety reasons, obviously. Some of these one-day classes is fine, but we went a little bit above and beyond for the purpose of safety and knowing exactly what we're doing and being trained. Spent some time in Seattle, Denver, got the chance to join AMSPA and do some conferences in New York. So it was a year-long training venture for me before I decided this is what I wanted to do with my nurse practitioner degree.
There's such a wide spectrum of services I know that you offer, from the aesthetics, the wellness aspect, the weight loss aspect. I know a lot of people are familiar with the names Ozempic and Wegovy and Mounjaro, but those are all GLP-1s. And do you all work in that space too?
We do. Mm-hmm. We
Okay.
have medically guided weight loss plans as a nurse practitioner. We can get lab work. We can look at hormone levels. We can see exactly why you're not losing weight and if these are something that benefits you. We use compound pharmacies to cut costs for people who their insurance doesn't exactly pay for those kind of prescriptions. So it's more affordable.
I'll call it a clinic. In your clinic, you have this thing that looks like to me like a Dance Revolution machine. You get up on it and it kind of spins around. What does that do?
Correct. So we have a machine called Shape Scale, and it does a 3D, 4D body scanning, full scans, and it tells us all of your measurements and your visceral fat and your muscle mass and your BMI. So every time you come in for a checkup, or if you just want to come by and weigh in and see what your progress looks like, you can get a scan. We can compare those. It's an app you can download on your phone, and so you can keep track of your progress.
I love it. Like the dance revolution.
It kinda does.
Every time you come in, I'm getting a dance revolution. That's
Yeah,
fun.
Get
right?
your little progress report. You and Miss Buckles have been working on several different projects, and I kind of want to walk us through some of the things that you all are working on. But I know one of the first things that she brought home was a program, a product, a treatment called Latisse. What is Latisse?
So Latisse is something that is a prescription grade, and it helps with growth factors of your eyelashes, and some people even use it on their eyebrows. but it's for volume for eyelashes, and it's something that works really, really well. Price point is very reasonable. It's anywhere from $99 to $130 percent, depending on what type that you want, the percentage.
Right.
But for people who don't want to get lash extensions, it's kind of a better, affordable, readily you can do it home option.
Now, I think she started that maybe 3 weeks ago or so. And I think you shared with her maybe about a month is where you start to really see the byproducts or the improvements. But at this point, have you been able to study her and see if she's making improvement with the Latisse?
I think so. I think we can see a little bit more
I think
volume.
so.
Do they feel better to you, hon?
They do. I mean, it's I'm a big fan of mascara. So I know when I'm putting it on, like the difference. And because when you put on mascara, after you put on that first layer or two, you go to the tips to add. And I'm not having to do that as much because I can tell that they're growing. If that makes any sense. Absolutely.
I presume, much like any patient or any consult that you do, you have an initial meeting and you sort of do an overall a review, an intake, if you will, however you want to label it. But I notice, part of your branding is redefining your own beauty. And is that the point, Amy, where you really listen to the patient and figure out where is it that you want to go here?
Right.
And then kind of create and see what plans you might create. How does that process work?
So what we're not going to do is have somebody come in and start picking apart your face. That's not our point in that. There's things that women like and don't like about themselves and maybe just want a tweak here and there. And we're there to support that and offer all of our consultations are free for our aesthetics programs. And we just sit and chat and kick off your shoes and get a warm blanket. And kind of like Christy when she first come in.
I just curled up on the couch.
Just curl up on the couch. We'll have a little girl talk and kind of just see what you want to tweak or fix. And it's really not a fix. It's just improve upon.
It is an interesting combination of it. Feels there are aspects of it that feel clinical. Mm-hmm. There are aspects of it that feel luxurious and warm and pampering. And I presume that's the vibe that you're trying to create at Pure Aesthetics and Wellness. When you talked with Christy originally, what were the things that she expressed that you all would try and address? It's okay.
Everything's on the table.
Okay.
Go ahead. Yes.
So when you get to be over 30, we'll start there.
Okay.
Sometimes we lose volume. We lose volume in our face. Weight loss, sometimes your skin changes. Sun damage, all of us 80s babies that didn't use sunscreen, that baked in baby oil or whatever the situation was, you get fine lines and wrinkles. And with Christy, we was really going to focus on forehead first and overall skin firmness and appearance and fine lines, I think is where we kind of wanted to start.
Yes.
Okay. And let's talk a little bit about that process. I know you all did a treatment, you did a procedure on that. Kind of explain what you did and what you were trying to do.
So we did a couple. The first one that we started with was Botox. And so for people that are kind of scared of needles and Botox and what that kind of feels like, Botox is a neurotoxin, and basically it's just to relax those dynamic facial muscles because we all have that scowl sometimes or raise our eyebrows real high. And when you do that, it just causes some fine lines and wrinkles with aging. And so Christy got Botox on her patelis. We did a lateral brow lift, and we done her crow's feet.
Okay, so you sort of started at the top, and you kind of work your way down. Mm-hmm. And is everything you do part of an overall structure? As if to ask this: when you're working on this area, are you also taking into account some place that you're trying to go?
Correct.
Okay,
we're trying to just make everything very symmetric.
Okay, and do people naturally have a little bit of asymmetry in their face?
They do.
Okay. And probably most people don't realize that.
We have learned that along the way with me. I definitely have some asymmetry going on.
Yeah. One of the things that I noticed, Amy, when you all were doing some of this, I noticed that you have a lot of diagrams on your wall or a lot of literature that really shows, I guess, the nervous system, the musculature of the face, et cetera. And I noticed that you all spent a lot of time kind of talking internally I know part of it was a teaching tool on your part, but you're really kind of studying and having to examine what are we doing here, and you got to be careful, right?
Correct. There's certain red zones that we call it that we don't want to get into. And
Okay.
it's not to scare people, but when we do our consultations, I want them to be aware of what areas we're doing certain things in and what areas we're staying away from. Because a lot of people that come in will say, well, I want this done. Well, I can't really do that. And we're not going to do that because it's not safe. So
Right.
that's kind of why those diagrams are there, so that we can kind of educate as we do our treatment plan.
I thought it was helpful. I wasn't having the procedure, and it made me feel more confident. It's like, okay, I see the end game here. Now, honey, there had to be some level of anxiety about this, because anytime there are needles and face involved, you can't just go like, oh yeah, give me more of that. But how did you approach it, and what was your experience?
Well, so I've known Amy for, I don't know.
20 years, I think.
I mean, it's been a
Yeah,
long
it's been a long
time.
time.
So that obviously was, it set me more at ease. But just like she said, me coming in that first day, curling up on the couch, actually talking about it, her background, and my mother retired from a plastic surgeon's office after working there for 25 years. Amy's background and education and talking through that definitely was a big part, because as you know, I have looked into doing things, but I've yet to go and do that. I just didn't feel as comfortable or, whatever. But having that conversation, listening, learning, she tells you everything that she's doing. Every stick, you okay? You okay? I don't know. Did that answer it?
Yeah, sure. I think one of the things that I want to share with people is most anyone is going to have a little bit of fear, but anyone who has gone through it that can attest for, it's safe, you're comfortable, et cetera. I think it helps build confidence in maybe
Absolutely.
people taking that step and reaching out.
And she's really, you are really good about making the client comfortable. So whether it's the ability to use lidocaine or whatever it is, what's going to happen. You feel, I don't remember how you worded it, but there are some sticks that are just a little
Spicy.
bit spicy. That's it. That's
This
Spicy.
is going to be a little spicy.
Yes, and
Very
she'll give
spicy.
you that prior, and you're like, okay. But yes. So we started at, like we talked about at the top, and then we've moved down.
Okay, so you all are on a journey.
We are.
You had an initial consultation and said, okay, here are the places we like to go. And you said, here are the areas that I'm not really happy with that I'd like to address. So, Amy, where are you all going from here, as best you know?
So we've already done besides the Botox, we've done some dermal fillers also. And so a lot of people don't know the difference between Botox and dermal fillers. So where Botox will relax and kind of make that muscle not move, dermal fillers are more for volume replacement as we get older and we lose volume or you've lost weight. And so Christy had a couple of really deep lines here in her nasolabial folds. And so we put a little bit of dermal filler there and a little bit of lip filler, actually, the next time. She had a little bit of asymmetry on one side.
Yes.
And we realized that when we started looking back at pictures. We had to do a side-by-side to
We
be
did, yes.
going through her Facebook history. And we're like, okay, is this
Wait a
something
minute.
that's new or is this something we just didn't see? And so we put a little more on her left side than her right. She has about a half a syringe in her top lip. We didn't do a whole lot in her bottom because she didn't really need it. We use a BLT cream, which is a really good numbing cream. I don't personally think that it's very painful. I've done myself, to be honest.
I do not either. And I've had that question asked, about several the things that we have done, all the things that we've done, because people have heard, oh, it hurts, it's painful. It's this. For me, no, it has not been. So.
And is that the chemical peel?
No, we done that too.
Did a chemical
So
peel as
that
well?
was the third thing that we
Right.
kind of went above and beyond last week a little bit.
That's okay.
But so a chemical peel, they're really underrated, honestly.
Oh, wow.
And something interesting about chemical peels that a lot of people don't know, it reduces your chance of getting skin cancer by 40% by doing chemical peels. It's a very inexpensive way to treat hyperpigmentation, skin, fine lines, and wrinkles. It just rejuvenates your skin. versus going and getting a laser treatment, which is very expensive. Chemical peels are very reasonably priced.
So I think what I'm hearing is, as we get older and our bodies, they just change. There's no other alternative to the aging process. But the way that I kind of like the way things are tying together is there are clearly things that she thought, well, being over 30, I would like to change
I love that,
I would like to
right?
change these
Over
things.
30.
I would like to do this. I would like to do that, which then bolsters confidence, and then confidence, I would imagine, impacts mood, health, and then overall wellness. So there's a tether of all these things where it's not necessarily weight loss, but a good attitude and confidence can certainly help in the weight loss space. So are these things tethered?
They are all tethered together.
Well, and just like I talked about a week or so ago, I was more fresh faced on the show. I have been very self conscious with the cameras, and you know that. I feel so much different, like better. I have more confidence in that, and I think you don't have to be on camera to do it. But I mean, there are ways that, like in your job or just yourself, when you see some of those things that bother you disappear or get better, it does. You feel like a different person.
All right. I want to take a moment and talk directly to the men who are with us.
Oh,
Okay.
I was hoping for this.
Men, the women in your lives want this. Okay. So matter of fact, that's what they want for Christmas. So Amy, how do we go? Do you have gift baskets?
We do. We're going to have gift baskets. They'll be available for sale during Black Friday. We're going to have a big sale. We also partnered with Green Soapery out of Owensboro, and we have nice soaps that are homemade and body scrubs. And we have laser hair removal packages that you can get.
Woot woot.
Yeah. And then online, we have all of our gift cards that are available for purchase. And then we're going to be running some specials. If you buy $250 gift card, then you get $50 for yourself. And then excess up, $500, you would get a bigger discount. So
Sure. Oh, it sounds great. I know you'll be back again. Did you have something before we go?
I do.
Okay,
Well,
what is
so
it?
when you went into the men area, I guess I knew that you were going to talk about gifts or whatever, but she doesn't just see women.
That's right.
no, we don't.
I mean,
We have several men that come in for
men also
services.
have things that they may not particularly care about themselves. So it's not just a female thing.
Yeah, vanity is not gender specific. Vanity appeals to everyone, and so I know that what you all are on is a journey. And so, Amy, you'll be back again soon, and we'll kind of talk about the extension of the journey. We might talk about we'll talk more about specifically about men, other treatments, and then we'll be closer to the holidays as well. But perhaps the two most important things: South English Street in Litchfield. And then pureaesthetics.life is the website. And basically everything, all that you need, booking, etc., is right there on the website.
Yes, correct.
All right. That's Amy Abels from Pure Aesthetics and Wellness, our guest here on In the Know.